Hey everyone, welcome to another episode of Tech Podcast's Dev Technosis. I'm your host Yash, and today we're covering a very relevant topic in the world of health and wellness tech: how mobile health apps are now helping you measure your blood oxygen levels using SpO2 sensors. This isn't just about wearables anymore. We're now in an era where your smartphone and connected health apps can give you real time oxygen data, critical during respiratory illness, workouts, or even daily health tracking. To dive deep into this, I'm joined by Alex, a digital health strategist and consultant who's worked closely with healthcare startups and development teams at DevTechnosis. Hey Alex, great to have you on the show.
Hey Yash, happy to be here. This is such an exciting space, the kind of tech that not only informs but can actually save lives. I'm glad we're talking about this today.
Absolutely. Let's get into the basics first. For someone new to this, what exactly is SpO2?
SpO2 refers to the peripheral capillary oxygen saturation level. It's a measure of how much oxygen your red blood cells are carrying compared to their full capacity. A healthy range is typically between 95% and 100%. If your oxygen level drops too low, it might be a sign of something serious, like respiratory problems, asthma, COVID-related issues, or high-altitude sickness. That's why measuring SpO2 at home is becoming a big deal, especially post-pandemic.
And traditionally, you'd use a pulse oximeter, those fingertip devices, right?
Exactly. But with the rise of smartwatches, fitness trackers, and even some smartphones, we're now seeing SpO2 monitoring integrated into wearable tech. These wearables sync with mobile apps, allowing users to not only check their oxygen levels, but also track trends over time, set alerts, and share data with doctors.
That's a huge step forward. How accurate are these devices compared to medical tools?
That's a common question. While hospital-grade equipment is still the gold standard, many wearables today, especially those by trusted brands like Apple, Fitbit, and Garmin, provide fairly accurate readings for general use. Of course, these readings should not replace professional diagnosis, but they're excellent for continuous monitoring, catching early warning signs, and encouraging proactive health checks.
So let's talk about the role of health apps here. What exactly are these apps doing when paired with SpO2 sensors?
Great question. The apps serve as the central hub. They collect raw SpO2 data from the sensor, whether it's on a smartwatch, ring, or fitness band, and then visualize it for the user. You get easy-to-read graphs, trends over weeks or months, comparison with heart rate or sleep patterns, and even alerts if your oxygen drops below a certain threshold. Some advanced apps also integrate with health dashboards, letting you track SpO2 alongside glucose, temperature, and step count.
Sounds like a whole ecosystem of real-time health awareness. Are there apps that stand out in this category?
Yes, Apple Health, Samsung Health, and Fitbit's ecosystem are some of the most refined. But we're also seeing custom health apps being developed by clinics and wellness brands using platforms like the ones DevTechnosis builds. These apps are tailored. They include SpO2, yes, but also symptom tracking, doctor video consultations, and remote patient monitoring. They're HIPAA compliant, secure, and focused on long-term care.
Let's go a little deeper into use cases. When should someone be checking their oxygen levels? Good point. There are a few scenarios where this becomes really helpful. During illness. If you have symptoms of COVID, pneumonia, or bronchitis, tracking SpO2 helps detect silent hypoxia. Fitness and workouts. Athletes use it during endurance training to see how their body responds to exertion and recovery. Sleep monitoring. Some users track overnight SpO2 to check for potential sleep apnea or breathing irregularities. Altitude training or travel. For people going to high-altitude areas, SpO2 tracking helps prevent altitude sickness. In each of these cases, health apps provide not just raw numbers but intelligent feedback.
Right, and that's the key. Not just data, but interpretation. I've seen apps that even color code your readings, give you tips, or tell you when it's time to consult a doctor.
Exactly. The integration of AI-driven analytics is taking this to the next level. Apps can now recognize patterns, say consistently low SpO2 after certain activities, and prompt you to log symptoms or seek help. The end goal isn't just tracking, it's enabling people to act early.
Let's talk a bit about development. If a health startup wants to build an app with SpO2 integration, what are the challenges?
There are a few layers to this. Sensor integration. First, you need access to reliable SpO2 data. That means working with APIs from wearable makers like Apple's HealthKit or Google Fit. Real-time syncing, users expect instant readings, so you need smooth Bluetooth syncing and a responsive UI. Data security. This is health data. Encryption, HIPAA compliance, and secure cloud storage are must-haves. User experience. The app should be intuitive, especially for older adults or those using it during illness. AI insights. Adding machine learning to personalize alerts and detect trends can really differentiate the product. This is where a company like DevTechnosis plays a big role. They know how to blend all of these needs into one clean, powerful app.
That makes sense. I imagine a lot of general wellness apps will soon offer SpO2 tracking as a default feature, right?
Yes, we're already seeing it. But there's also a rise in niche apps. For example, one focused on lung health for asthma patients, or another for senior care that alerts caregivers if SpO2 drops. Customization is everything now, and it's being driven by demand. People want to monitor their health 24/7 without expensive clinic visits.
So this isn't a trend. This is the future of preventative healthcare?
Absolutely. We're moving from reactive care, where you only act when something's wrong, to proactive monitoring. SpO2 tracking is a perfect example of this shift. With the right tools, people can stay informed, safe, and empowered.
Love that. Last question. What's your personal favorite part about this tech?
Honestly, it's accessibility. You don't need to be a techie or a doctor. Anyone, even a grandparent or teenager, can check their oxygen levels on a daily basis now, thanks to health apps. And when tech becomes that usable, that human, it's a big win.
Well said, Alex. This has been such an insightful discussion. Thank you for joining us on Tech Podcast's Dev Technosis.
Thanks for having me, Yash. Always a pleasure.
And to our listeners, if you're building a health monitoring app, wearable integration platform, or looking to launch your own remote patient tracking tool, be sure to check out devtechnosis.com. They're powering the future of healthcare, one smart solution at a time. Until next time, stay safe, breathe easy, and keep checking in with your health. I'm Yash, signing off from Tech Podcast's Dev Technosis.